Hi, I am Dr. Prasad Neelam, consultant surgical gastroenterologist, Sravani Hospitals. On the occasion of World Pancreatic Cancer Day, today we will discuss about the symptoms of pancreatic cancer and how do we treat and diagnose pancreatic cancer. So, pancreatic cancer is the seventh most common cause for cancer deaths in the world. And coming to the presentation of pancreatic cancer, so it's very difficult to diagnose pancreatic cancer in the early stage. Only 15 to 20% of the patients will be detected with pancreatic cancer in the early stages. Remaining 80% of the patients, by the time the symptoms comes, the disease will be advanced. Why? Because since the pancreas is a retroperitoneal organ, the symptoms are very difficult to distinguish in the early stages. So whenever the pancreatic cancer is there, the patients present with, one is back pain. Next is when it blocks the bile duct. So here you can see the pancreatic cancer blocking the bile duct. Then they present with jaundice. Next, when they block the small intestine, then it will cause vomitings. And when this pancreatic cancer damages the insulin producing cells in the pancreas, then it will cause new onset diabetes, and most of the patients will have weight loss and loss of appetite. So those patients at risk are smoking patients, alcoholic patients, those who have more weight, obese patients, and those who have a family history of pancreatic cancer and genetic diseases. So those are at risk of pancreatic cancer, and most of the times the patients presenting in the early stage will have 40 to 50% 5-year survival rate, and in advanced stage the survival rate will be less than 15 to 20%. So whenever the patient is presented with fever with jaundice in the form of cholangitis, we will do a bile duct stenting to relieve the jaundice, followed by Whipple's pancreaticoduodenectomy surgery. If at all there is no jaundice, or if at all the patient is having less jaundice without cholangitis, we will straight away do a Whipple's pancreaticoduodenectomy surgery.